Well, and thank you for having me. I will say these really were good faith negotiations that really were a robust exchange of data, talking about, the clinical benefits of these drugs and other factors as laid out in the prescription drug law. The team that was negotiating includes clinical pharmacists, drug pricing experts, people who had done negotiations for health plans, for drug manufacturers. So really bringing that expertise to CMS to stand up this historic program, because as you mentioned, first time that Medicare has negotiated directly with pharmaceutical manufacturers for the price of 10 of the highest cost drugs in the Medicare program.
Dr. Seshamani, I wonder, considering that the response on Wall Street is muted, we haven't really seen the stocks move as a result. We know that Wall Street did kind of price it in a bit. And then in addition to that, there's criticisms that this could then shift the cost burden onto patients as insurance companies look to figure out how to recalculate, as well as PBMs limiting access. Is this truly a win then for the government?
Well, the negotiated prices, we estimate, will save the Medicare program $6 billion. So if these prices were in effect in 2023, we would have saved $6 billion and $1.5 billion for people in the Medicare program who have prescription drug coverage. So they would save $1.5 billion out of pocket with the better deal that we have gotten with negotiation.
I also wonder, with all the information you've now had access to and are privy to, when it comes to the way that drug prices are set in this country, we know it's a very opaque process. Your process in itself was also somewhat opaque because we do not know the net prices that Medicare pays. So I wonder, with all that you've learned, how can we translate this maybe for the general public to understand in how these prices are set? Is there a sort of percentage range that they are marked up based on the cost? Have you learned other information that could help broadly with drug pricing and negotiations, maybe in the private market?
Well, transparency is very important, and I think that has been the main goal of standing up this program. In the spring, we will be publishing justifications for these prices and talking about the data that went into this, understanding and respecting that proprietary information, as you mentioned, stays confidential. But right now, everybody now knows these negotiated prices, and others can take that information into account. And as we went through the process of standing up this program, we engaged everyone. We had 10 patient-focused listening sessions so we could incorporate the patient voice, talking with healthcare providers, with health plans, with drug companies, multiple opportunities for comment on our guidance, and information collection requests to stand up this program. And we want to continue that moving forward. We have asked for comment for our guidance for the next cycle of negotiations, where we can take the lessons learned here. So really being able to incorporate real world evidence, incorporate data into understanding how drug pricing works, and to be able to make sure that we are achieving our shared goal of access and affordability for the kinds of innovative cures and therapies that people need.
I want to look ahead to November and talk about potential policy changes. The Trump campaign's Project 2025 in particular calls for a repeal of the IRA. Could that potentially jeopardize the work that you're already starting for the next round of negotiations?
From the day that the Inflation Reduction Act, the prescription drug law, was passed, we have really engaged in being as thoughtful as possible in implementation. Talking with health plans as we were putting into place the $35 insulin copay cap, $0 vaccines. I was talking to the health plan CEOs saying, we have to work together because the law passed in August and this went into effect in January, just a few months later. To the standing up the negotiation program, really incorporating all of the feedback from everyone who is involved and is impacted by drug pricing, supply, et cetera, in the United States. And I think what you see today with the results of the negotiation program really demonstrate the thoughtful, pragmatic nature that this program has been stood up and that will continue in the future.
And finally, Dr. Seshamani, I wonder, when we're talking about the impact to patients, you've mentioned the out-of-pocket costs and the $6 billion in savings. The Congressional Budget Office has estimated that the program could save as much as $100 billion by 2031. That looks like a pretty large gap to fill in the upcoming negotiations. Where do you see room for maybe more aggressive negotiating to get greater savings?
Well, as laid out in the law, the number of drugs that Medicare negotiates will be going up. So it was 10 drugs for this first year. It becomes 15 the next year, and it goes up to 20. And so over time, additional drugs get negotiated on top of the ones that have already been negotiated, which translates to increased savings in Medicare. And I think, to come back to a point that you all raised about the transparency, this also has been a great opportunity to have a robust, data-driven discussion about the benefits that drugs provide, really incorporating how drugs impact people's lives in the communities in which they live. Because people don't live lives like a randomized controlled trial, and being able to incorporate the perspective, for example, of caregivers and how drugs can impact someone's health, can affect, downstream healthcare costs. All of that has been very important to include, and I look forward to that robust discussion continuing as the number of drugs are increased that are negotiated.